All right, perfect. I do see people joining. So, hi everyone. Hey, thank you so much for joining in, everybody. I'm just going to wait for another 20 seconds. So, everybody who has joined can take a moment, get familiar with Zoom if they are using it for the first time. And I think we have most of the people that I saw in the waiting room. So, formally, everyone, thank you so much for joining in and welcome to HTA's webinar. My name is Danish Khan, and I work at HTA as the product manager, which means that all of the products, all of the programs that we have here, I design them with my team. And I'm going to talk a lot of the things that we do here at HTA and the programs that we offer today here in this webinar. So I'll start off by sharing my screen that you guys will see in a moment. And here we go. So you guys will be able to see the screen now. So this is Allied Healthcare Bootcamp webinar, which means a lot of the bootcamps, all of the bootcamps that we offer, I'll be covering the details about them. And to start off, this is just a snapshot of what HTA is, what Health Tech Academy is. And we currently have more than 1,500 students that are enrolled in one of our programs. And we have 25 plus coaches that work with us, and they offer one-on-one coaching sessions to the students. All of these coaches come with 10 plus years of experience in the relevant field. We have more than 10 boot camps that we offer, and I'm going to cover all of them today here in this webinar. All of our students who complete our training program and pass the certification exam, that's the two things that they have to do in order to be fully certified. And then for some of the programs, they have to complete the externship requirements. So if they complete all these three requirements or two requirements in the case of a few other programs, um, if they complete that, considering all those students, our placement rate is 100%. So all the students who have completed all the requirements, we were able to place them in one another job. So that's a great number. And then we have our headquarters based in Austin. So before I jump onto the next slide, I just want to make sure that you guys are familiar with the webinar format. I'm going to speak for the most part, which is going to be the first 30 minutes or so, but we are going to have question answers towards the end. So there will be 10 to 15 minutes at the end that we will use for any of the questions that you guys may have. I would like you guys to see the question answer. I think there should be a question answer feature. If not, then we also have the chat that you guys can use. I do recommend that you use it at the end of the session. Keep your questions with you, and I will answer them at the end of the session. But if you feel there's a question that you would like me to address straight away, I'm more than happy to address it straight away as well. Um, yeah, I think we should be fine. Yeah. Hello, I happen to have a meeting to go. How long will it? The session is going to be about 45 minutes, so you can stay back if you can. Otherwise, the session is being recorded, so you will get to know about it. Uh, so yeah, I've told you guys about the question answers session at the end. So table of content, we're going to talk about Health Tech Academy. I've given you a little bit of information. There will be a lot more that I'll be sharing in a bit. Then I'll be talking about the future of allied healthcare and why all of you guys who are interested in enrolling one of our programs can really make you relevant in the future. So we are going to look at a few trends and how you can stay relevant to those trends in the future. So we'll discuss that. And here are the list of the boot camps that I'm going to talk about. In fact, there are a couple of the boot camps that are not mentioned here, and I'm going to talk about those. Then I'm going to talk about the admission process, then some financing options. Then I'm going to talk about the HTA career services, which is very, very crucial part for anybody who is, trying to find jobs or trying to find clinicals for completion of their clinical requirements of the certification programs. So HTA Career Services team is there to help them. Then you will hear from some of our students. So we have a few testimonials that we will play in the session. And then at the end, we'll have the question answers, and I'll also answer some of the frequently asked questions. So starting off with Health Tech Academy. So we are a leader in flexible and accessible online training for more than 20 years. That's our team. Our team has been working in the edtech sector for more than 20 years. And we build programs around the growing areas and the fields of allied healthcare. We are headquartered in Austin, Texas, and we aim to transform healthcare education and staffing with a focus on excellence, innovation, and personalized learning. Our flexible healthcare bootcamps are delivered 100% online, self-paced, and tailored to fit seamlessly into your schedule. So you can be anybody who has a full-time job or who is working full-time anywhere, or you are a full-time student, or you're a mom, whatever it is, you can really use this program because it's self-paced and can fit into your schedule, and because it's very, very flexible. So our vision is to transform and innovate the way healthcare professionals are educated, hired, and retained. And our mission is to solve healthcare staffing challenges by partnering with universities, employers, and educating citizens for emerging and diverse roles through apprenticeship, learning pathways, and career coaching. Um, how our boot camps work. We work with industry experts, universities, employers, and healthcare partners to create industry-aligned boot camps. Our bootcamp modules, courses, and instruction models are designed to fit around your schedule, as I already shared. We emphasize on online learner success through bootcamp support and career services. The three key aspects of our bootcamp, and I'm going to repeat them again and again throughout the session so you guys remember this, that these sessions, all of these programs are on demand, which means that you can start them anytime that you want to start. So if you enroll today, you can start the program the next day or the next moment. And these are self-paced, which means that there are no live sessions that take place, and you don't need to have a schedule of sorts. You can, sometimes do the sessions, or take the course in the morning, sometimes in the evening, sometimes on the weekend, up to you, whatever schedule you want to follow. And then we have one-on-one coaching sessions that are available for you, where you can schedule a session with an expert from the industry one-on-one, and they will talk you through any of the issues that you may have, any of the concerns that you may have, any things that you wouldn't be understanding. They can talk about it with you in those sessions. So we have quite a lot of partners. These are, very few of them that you can see on the screen. We are affiliated with more than 12 networks of hospitals and healthcare institutes around the US. But we have availability of clinics and hospitals in more than 30 locations across US, which allows a lot of our students to get the benefit in terms of their placements or externship requirements that they can complete in those sites. Although there are a lot of complexities around it, I'm not going to say that everybody will be able to find a site through these partners, but we will offer you a lot of support through these partners and otherwise, and I'll talk about that in a few minutes. The program flexibility is something that is very, very important, and we want you to understand that you don't need to relocate to any place, because all of the programs are 100% online, and the programs are designed for everybody who is a beginner and they might have limited healthcare background, so you can still enroll into all of our programs. And this is the most exciting part in my point of view. So, future of allied healthcare. If you look at the 2024 allied healthcare job trends, the insights that you find around it, these roles are very, very high in demand. And I think all of you guys know that, and maybe that is one of the reasons why you want to start your career in this field. The jobs are absolutely going to increase as the time passes, but at the same time, the jobs are also evolving. They are going to involve more and more technology, such as remote patient monitoring or AI-driven diagnostics. So the dependency on the technology is on the rise, and it's going to increase day by day as well. The best way to catch the future like healthcare trends is to be working in the industry and to really understand the industry as well, and the kind of trends that you are seeing in the industry. No matter what kind of role you are in, you got to understand where the industry is headed. So you have to gain the industry experience through an entry level position, and then you can grow from that point onwards. If you look at some of the trends which are directly relevant to some of the programs that we offer, for example, in the surgical technology, intraoperative imaging is something that is on the rise. Robotic assisted surgery is something that is very, very useful in the modern age. But I don't want you guys to be scared about it, because that doesn't mean that the robots are ever going to, in my point of view, they're ever going to replace the search text, because at the end of the day, artificial intelligence at the end of the day is artificial intelligence, and you need the human intelligence, the human brain to be working to resolve any issues or to supervise. So those kind of roles are always going to remain there. They will evolve, they will change, but your need would be there in those sectors. Similarly, in pharmacy technology, we have a lot of dispensing automations, a lot of AI that is involved in the pharmacy software management, and a lot of other stuff. Similarly, healthcare record management is done through AI. Patient assessment is automated. And similarly, for sterile processing, there are a lot of automations and AI involvement there. And it is very, very important that if you are interested in one of these fields or any other field, you research about the trends that we are going to see in the future, or the ones that we are seeing right now, where technology is tested out, how the, like, how it can improve all the processes, and how it can make the whole process more efficient in a lot of ways. So read about it, research about it, so you know what is coming up for you in that field. And that takes me to the next part of our webinar, which is probably going to be the longest part, but there are a lot of things that are repetitions for each of the programs, so I'm not going to repeat them. So I'll say that this is the same from the last bootcamp that I covered. So I hope we can cover it in the next 10 to 15 minutes. So starting off with our surgical technologist program, this is Tech in Surgery certification by NCCT, and the duration of this program is 16 weeks. Now, for the duration, I want you all to understand that the duration that we are saying, it's a 16 weeks long program, but that's something that we are saying with an estimate that you are spending about 12 to 15 hours a week. And if you are working on that pace, you will be able to complete the program in 16 weeks. A lot of our students complete it sooner. A lot of students take a bit longer, but that's the average time that is required to complete the program. So just keep that in mind. It depends on your pace. The certification is by NCCT. It's Tech in Surgery Certification, TSC. That's the certification that we offer. The tuition is $3,450 upfront. That's the fee if you have to pay in full. And we also have a lot of monthly payment options, which start from $266. Remember, $266 is the installment. The deposit that you have to make can be different in different cases. So if you pay a bigger deposit, the installment would, of course, be lower. But the minimum is $266. But the deposit number can be different, and that you can consult with your admission advisor, and they can give you more details about. The eligibility for all of our programs is high school diploma or GED equivalence qualification, and you should also have internet. One thing that we haven't written here, and I would like to point it out, and that's that we expect all of our students to know how to browse on internet, how to use different platforms on laptop, because we need them to navigate through our platform easily. So that's the eligibility. In terms of the offerings, we have self-paced online program, one-on-one coaching sessions, certification exam preparation, career sport, ebook is there. There are skills videos that are there for you to understand the skills, because most of these programs are skills, hardcore skills that you're going to use in a clinic. So it's very important that you observe how those procedures are done, and that's done through the skills videos. And then we have exam vouchers that are included in this cost. Now, restricted states is something that I want all of you guys to understand, and that's something which is not in our control because each state has different regulations when it comes to these training programs. So there are states out there that do not accept a particular certification, and they have an alternative certification that they want anybody working as a search tech to have in their state. Those restricted states, you can see there, these are a few states where this program, TSC by NCCT, is not available. So if you are from one of these states, we would not enroll you in this program because you will not be able to find a role, a job in these states because of these regulations. So we will not be able to enroll you in this program. If you are interested in search tech and you are from one of these states, better find out some other training programs that are accepted in your state. You can download the syllabus. It's an outline of the whole program from our website. Feel free to reach out to our team if you cannot find that link. But if you go to the website and the program page for Search Tech, you will absolutely be able to find it. For the next program, I think there's a question about Viova grant still able to cover the costs. It depends on your eligibility, but I'm going to share more details about the Viova grants in maybe next 15 or 20 minutes. Medical assistant program is pretty similar to Surge Tech when it comes to the duration of the program. So the duration is 16 weeks. The certification is CCMA, Certified Clinical Medical Assistant by NHA. The tuition is the same as Surge Tech, and the eligibility is also the same. In the offerings, we have self-paced online program where you get access to our learning dashboard, and you complete your program there. You have one-on-one coaching sessions. Every student is required or is allowed to take up to 5 coaching sessions with an industry expert where you meet them one-on-one for 30 to 35 minutes. For each session, you have about 30 to 40 minutes. And you can ask them any questions and discuss any confusions that you have from the content that you are reading or you are learning. Then we have certification exam preparation course at the end of the program. Before you appear for the actual exam, we have the official certification exam that you can complete. Then we have career support available for you that can help you with the job hunt, with developing your professional profile, and anything else that you need in terms of the career support, any advice that you may need related to your career. Then we have the ebook, skills videos, and exam voucher. Again, exam voucher is included in the cost for all of our programs, so you wouldn't have to pay for it at the end once you complete your training. There are only 2 restricted states for medical assistant program. So if you are from one of these states, I'm sorry, I wouldn't be able to enroll you guys into this program. But if you are from these states, better find other programs because I am not sure if they have an alternative medical assistant program in these states, or maybe there are different regulations. So consult that, but this program is not for you. You can download the syllabus from the website. Patient care technician. So patient care technician role is very, very similar to medical assistant role. And this is something that I asked one of our SMEs in one of the webinars that we did. And I think she really explained it well, where she told that the medical assistant roles are partly administrative roles as well. They're not primarily administrative roles, but the secondary responsibilities that they have some administrative responsibilities. But when it comes to patient care technician, all what they are supposed to do is patient care and nothing else. There's nothing administrative that they have to do. The program is pretty similar to medical assistant. Even the content is pretty similar, except the administrative parts. And the eligibility is the same. It's a certified patient care technician certification by NHA, and the offerings are the same as well. And we have 3 restricted states. North Dakota is the 3rd state, which wasn't there for certified clinical medical assistant program. So keep that in mind, and you can download the syllabus from the website if you are interested in this program. Then we have pharmacy technician program, which is by NHA. Again, most of the information here is the same as patient care technician and medical assistant, but The restricted states are a lot more for this particular program. Pharmacy technician is a very, very high demand role. I mean, it is for like rest of the programs as well. But at the same time, there are other certifications that are more widely accepted across US. Until 3 months ago, we were not offering those, but now I'm really happy to announce that we have another certification that we are offering for the pharmacy technician program. It's the same program, but now it covers the content for the other certification, which is by PTCB. And remember this, when you look at the PTCB slide, you will see that there, I think, no restricted states. So they're accepted all across the US. So you can choose one of these certification. It will be very much up to you. You can enroll into the program and you can see what is more in demand in the area where you live for the roles that you want to apply for, and then you can choose which certification exam voucher you need. So I'll cover the PTCB pharmacy technician program in a bit. I think it comes at the end. So you can download the syllabus for this program as well from our website. The one by NHA is called Pharmacy Technician Bootcamp, and by the one by PTCB is called Pharmacy Technician Professional Program. So just keep that in mind. All right, so dental assistant program. It's a registered dental assistant certification by AMT. It's 16 weeks long. And just by the way, if I haven't shared this already, we are officially partnered with NHA to offer all these certifications. And we are also officially partners with AMT and NCCT for SurgeTech. So it would not take us a lot of time. Once all the process is completed and you complete all the requirements, you'll be able to sit for the exam pretty soon. The tuition is the same. I mean, for all of the programs that we have covered till now, most of the instructions are the same except the restricted states. And I absolutely encourage you to go onto our product page to read more about the program, to download the syllabus, and also see where you will find roles related to this field. And you'll also have some of the FAQs at the end of the product page that can answer a lot of your questions, or things that you would that's good to know before you talk to the admission advisor. And here you can see that there are 6 states where this program is not available. So just keep that in mind. CRCST. Okay, so I think one thing that I've been missing, and I haven't been sharing that, and I should have shared it with surgical technology. So for 4 of our certifications, in which Surge Tech is the first certification, we have externship requirements or clinicals requirements where you have to go into a clinic or a hospital, and you have to complete a certain number of cases or certain number of hours in order to be fully certified. And Surge Tech is one of those programs where that is a requirement, and you have to complete those requirements if you want to be fully certified and if you want to start working in this sector. So that's an extra step. And this step is not that easy. It requires a lot of patience, a lot of hard work. And our team, of course, helps you in every possible way. But that requirement is there, and you will have to fulfill that requirement before or after passing the exam. We do recommend that you complete those requirements first, because when you go into the field and you learn a lot of things practically, they absolutely help you to pass the exams in a much easier manner, and you score much better. So we do recommend that, but keep in mind that clinical requirements are there for Surge Tech. They're not there for medical assistant, for patient care, for pharmacy technician, or dental assistant. And they are there for sterile processing technician. Another thing that I want to share with you guys, as I'm going to talk about the sterile processing technician program, Surge Tech as a certification is seen as an advanced level certification because of all these complexities that we have about externships. It's not easy to find a Surge Tech role. So we do recommend that if there is anybody who does not have any kind of medical background, academic or professional, we recommend them to start off from sterile processing, gain some experience, and then jump on to Surge Tech, because that will increase their chances of finding a job or finding a clinical site in a lot of ways. So we recommend that. But at the end of the day, it's your decision, whatever you want to do. So for sterile processing technician, we have CRCST certification by HSPA. Again, we are affiliated with HSPA. Our program is 16 weeks long. It's an estimate, so you can complete it sooner if you can. And rest of the details are the same. Offerings are the same. One thing that's a typo here is that for sterile processing technician program, we don't have an ebook. We have a hard copy that is sent to you when you start the program, and there are no restricted states. You can download the syllabus from the website. All right, phlebotomy technician. So this is the first program where the price is different and it's a shorter program. So this program is 12 weeks long. It's certified phlebotomy technician certification by NHA. And the cost of this program is $2,000 if you are paying upfront. And if you want to pay in installments, the installment options start from $141. The eligibility is the same as well. Offerings are the same. You get the access to the content on day one on our learning dashboard, and then the coaching sessions are there. Exam preparation course at the end of the program, career sport, ebook, skills videos, exam voucher. Everything is included in this price. We have 6 restricted states for phlebotomy technicians. So if you are somebody who is based in one of these states and you're interested in this program, better look out for another program or another certification that is accepted by the state. You can download the syllabus from the website. So the next program that we have here, I am seeing if I have missed a program. No, I haven't. Okay. So the next program that we have is medical coding by AAPC. This is an advanced level certification. It's almost 14 weeks long. Again, an estimated number. The price is the same. This is an advanced level certification, so just keep that in mind. I think the order is very different, but the medical billing and coding certification, CBCS by NHA, this is for a lot of our students, this is where they start from, and then they do CPC afterwards. So if you are somebody who is starting into this career, medical billing and coding would be a lot easier for you to start your career in this field. So you complete this 12 weeks long program. It's a CBCS certification, certified billing and coding specialist by NHA. The price is the same, and there are no restricted states for this program. And once you start working as a medical biller, so if this program does not have a lot of coding components, so you learn billing and you find roles like medical billing specialist roles. And then once you gain some experience over there, and then you want to advance in your career, then medical coding certification is offered by HTA for you as a next step to advance your career. And then you can enroll in this one. The price is the same, and there are no restricted states. Again, you can download the syllabus from our website. So we have this program which is called Healthcare IT. It's 2 certifications that we offer in this program. So the price includes the cost for both these certifications. It's a 16 weeks long program. The first certification is IT Fundamental Plus by CompTIA, and the second certification is Certified Electronic Health Record Specialist by NHA. The cost of this program is $3,950, and if you pay on installments, monthly payments would be starting from $322. The eligibility is the same and the offerings are there. We only have 4 restricted states, and that is because of the CEHRS certification, because that certification is not accepted in these 4 states. One very important thing that I would like to share with all of you guys about this program is that this is one of those programs where we not only cover the content that is needed to pass the CEHRS exam and the CompTIA exam, we also cover a lot of other content that is required for anybody who wants to excel in the field of IT. And anybody who wants to work in the healthcare IT field, because there are a lot of things that you need to learn: basics of data literacy, data science, project management. You learn all these basic concepts as part of this program. So just keep that in mind. Medical Electronic Health Record Specialist. This is the same certification that we also have in Healthcare IT, but this is standalone, just focusing on CEHRS certification. It's a 12 weeks long program. Again, it's an estimate. The cost is $2,000, and the monthly installment options start from $141. You can see that there are four restricted states for this program. You can download the tables from the website. EKG, with I think, yeah, this again is a typo. It's CET, which is Certified EKG Technician by NHA. It's an 8 weeks long program. This is probably the shortest program that we have. The cost is $2,000. Eligibility is the same, offerings are the same, and there are no restricted states. So EKG and medical electronic health record specialists, these are two very good programs to start your career, because these are very short programs. You complete these certifications, find a job, and get into the healthcare career, and then you can, advance into other certifications like surge tech or medical assistant or whatever other certification you are interested in. For EKG technician as well, we have the clinical requirements that you have to complete if you want to be fully certified. So just keep that in mind. The next program that we have is healthcare leadership, and this is for anybody who wants to become a leader in the healthcare sector. And this covers all the basic concepts of becoming the leader, working with a team, and anybody who wants to become a better team player. I think they can benefit from such a program as well. There is no external certification that we offer for this program. It's a in-house certification that we offer, and this is for anybody who's starting off their career and they aspire to become a leader, or they want to become a better team player, or they're already working in the healthcare sector and they are now thinking about becoming a leader, or they have an opportunity to become a leader, or they are a very new leader and they want to learn something to be a better leader, or to be a better manager. Then this certification is for them. The requirements are pretty much the same. There are no restricted states, of course. And the tuition for this program is $3,950. And that brings me to the last program that we are going to cover today, and that is Pharmacy Technician Professional Bootcamp, which is by PTCB. I think there's a typo over here. It is not a HTA certification, it's a PTCB certification, and we are an approved education provider by PTCB, which you guys can find information on PTCB's website. And as I shared earlier, that this is our pharmacy technician professional program that we recently launched, and there are no restricted states for this program. So if you are interested in pharmacy technician program, I highly recommend you to go for PTCB certification, because that's widely accepted all across the US. You can download the syllabus for this program from the website as well. And that will now take me to a very important part for you guys, which is the admission process. And I think some of you guys are already part of this admission process. So the first step is to schedule the call with the admission advisor. Then you discuss the details of the bootcamp, and you see the eligibility requirements if you fulfill them. And then you pay the tuition and you complete your enrollment into your preferred bootcamp. You For tuition, we have a different options that we will be discussing right now. So we have upfront options where you can pay the upfront amount in total um, at the beginning, and we will offer you a very good discount if you choose to do that. Then we have monthly installments. We provide options for different installments through our financing partners like Fortify, Edley, Selime, where you will have to pay through these financing partners. We also have Study Now, Pay Later option, which is offered by a firm, where you will have to talk to the admissions team and you'll have to apply for it and see if you are eligible. Then we have military education benefits. So there are eligible students who can apply for military funding towards the cost of bootcamp. So if you are one of them, you can absolutely talk to the team about it and they can share more details. Then we have the OVA Workforce Innovation Opportunity Act fundings that are available as well. And I want you all to know that this is something that has a qualification criteria. So I want you to take a moment, look at the screen, and look at the qualification criteria. So it has to be somebody who is 18 years or older. You should have a GED or high school diploma or any equivalent qualification. You are unemployed or underemployed, and you receive food or cash assistance from the state. So that's how the qualification criteria works. And if you are one of them and you think you are eligible or you are unsure about it, but you would like to talk to somebody, please contact Carla Coleman. She's our Director of Workforce Development. You can also call her at this given number or send her an email, and then she will either assign somebody to talk to you or she will talk herself. And along with that, we also have tribal funding options that are there, where you can start the program, you can complete the program, become certified at no cost whatsoever. Where we have partnered with Native American Jumpstart, which is a nonprofit based in Jackson. So you can reach out to Carla if you think you are eligible for any of these fundings. And in case you haven't taken a screenshot and you would like to come back to this information, you can also find Carla's contact details on our website. So don't worry about that. All right, so HTA Career Services. Um, Hiring is a very personal decision based on a variety of unique variables, whatever career you want to choose, and what kind of role you want to pursue. And for this reason, we will never claim, nor we will promise to hand you a fish, because that's not how it works. You have to do a lot of things yourself, but we do promise you to give you all the knowledge and tools and help you understand that repetitive process to catch your first fish, because it requires a lot of patience. You have to reach out to a lot of potential employers, and we will connect you to the industry wherever we have the affiliations. So we will give you all of our support and mentorship, but we will never be able to hand you a fish. So just remember that. In terms of the resources and the support that we offer, we have one-on-one career advising sessions that will be there to help you, and you will be able to get a lot of support from your career service advisors. In the sessions, they're going to cover resume building, LinkedIn profile, how to reach out to the employers. They're going to give you certain scripts that you can use to reach out to your potential employers. And then externship process is something that most of our students need help with, and they offer all the support with it. We do not guarantee that you will find an externship site, but we offer all the support that we can offer in order to help you with the externship process. And there are a lot of other details that can be shared by the admission advisors. So if you need more information about the externship process, especially, reach out to the admission advisors, and they can share more details about the externship process, so you know how the process is going to look like, because it's a longer process. It takes a bit of time. It takes a lot of effort on your part and our part, and we will always be there to help you with it. But yeah, it does take a bit of time. In terms of the tools that we offer as part of our career services and the resources related to your professional development, we have a career prep course, which is there at the end of every program. So every bootcamp ends with a career prep course that helps you learn some of the soft and hard skills that you need in order to become a well-rounded professional. We have different professional profile building tools which are available to you, and our team will be there to also review your professional profiles. So you'll be able to communicate with the team, and they will be able to help you with that. In case you ever have an interview or you are going to talk to the employers, our teams will always be there to conduct an in-house interview for you, so that we can give you feedback and you can improve on the basis of the feedback that will be given to you. And here are some of the testimonials that we have from some of our students, which you guys can take a moment and read. These are for different programs. And we also have a testimonial from one of our students. Oh, not one, from 4 of our students here that you guys can see on the screen. And I am going to play all of them for maybe 1 minute each, so you guys can hear from them. Let me know if you guys can hear it. I think you guys should be able to do that.
My name is Efta Deshwathobi. I currently live in Miami, Florida. My aim is to do surgical tech, and I was able to find that out through Health Tech Academy through a referral of my sister, which we both signed up at the same time, and I'm pretty glad that she did because of the help of Health Tech Academy, with the fact that it is accredited with NCCT, which was an important factor into signing up and getting the help that I was able to receive from the career coaches, from the teachers, the professors, things like of that nature has been instrumental in the success rate of being able to work in a hospital. Looking for accelerated programs, Health Tech actually were able to pop up.
So I will move on to the next one so you guys can just get an idea what our students say about the programs. Okay, I'll have to scroll down back to, okay, let's hear from Alex Gomes. Let's not make it bigger so we don't have to do this. Okay.
My name is Alex Gomez. I'm from Indianapolis, however, I'm currently studying abroad in Australia. I came to know Health Tech Academy after thorough research, and I chose Health Tech Academy because I wanted to be able to travel and enjoy my summer. I am working towards my goal of PA school, and I found this to be the best solution by far. My journey with Health Tech Academy was really simple. I was able to work and learn on a weekly basis whenever I wanted, and there was always people to meet with online to help me if I needed. Overall, I highly recommend Health Tech Academy to anybody who wants to learn.
So these are some of the testimonials. You guys can also, watch these and others on our YouTube channel, and on our social media as well. And yeah, that takes me to the FAQ section and the question answer session. But before we answer the questions that you guys have shared, I just want to answer some of the questions that are here. How long does an HTA bootcamp take to complete? As shared earlier, just by the way, while I answer these FAQs, you guys can use the chat box or the question answer feature to send in your questions, and I'll respond to them as soon as I'm done with these FAQs. Okay, so coming back to the question, it takes about on average, it takes about 12 to 18 weeks to complete a boot camp. That's the average that I'm talking about for most of our students, but it really depends on your pace. We have had students who completed the program in 5, 6 weeks as well, but they were spending 20, 25 hours a week. So it really depends on your pace. It's self-paced. It's, in every way possible, self-paced, and you can complete it at your own pace. What are the tuition costs for an HTA bootcamp? They're different for each program. They start off from $2,000 and the maximum one is $3,950. Can I keep working while I take a bootcamp? That's the goal. That's the reason why we have self-paced, flexible bootcamps. You can absolutely work while you take this bootcamp. Will I get a job after completing an HTA bootcamp? You will be much more likely to find a job after you complete a bootcamp here at HTA, because all of these certifications are a requirement for you in order to work in those particular fields. However, we cannot guarantee that you will find a job straight away. It might take a bit of time. You will have to apply to different places and try your luck. But you will get all the support from the team in order to make that happen. What is the criteria to qualify to apply for HTA bootcamps? Anybody who has GED level qualification and they have internet and they know how to browse on the internet and use a laptop or a PC if they know about it. If they complete these three requirements, they qualify to become part of HTA as a student. And now I'll head to the question answer feature. Okay, I came late. I can have information about search tech. Yes, so my team has shared with you. You can read about the program on the website, and if you still have any questions, feel free to reach out to us. Abigail said that I want to enroll in a surgical technician program. I'm based in Atlanta, Georgia. Where will I go for clinicals? When is the next enrollment for this program? As we move forward, you guys can share your questions here in the chat. I'll be more than happy to answer. Abigail, I'm going to come back to your question, but you guys can visit our website by scanning this QR code. You can talk to the admissions and you can schedule a session with the admissions team by scanning this QR code. And if you're unsure which bootcamp is right for you, complete this career assessment quiz, and we will be able to tell you which program would be best for you. Abigail, you first have to see if the program is available for Georgia or not. So go back to that list where I've shared if the programs are restricted or not. So first of all, that's the thing that you need to know. Secondly, when it comes to clinicals, you can ask the team if we have any affiliations in Georgia. That shouldn't be a deal breaker, because at the same time, we are going to help you find a site within your locality. Because if you if you are based in an area in the same state which is too far away from the site that we have, it's not going to work out for you. So you will have to work with the team, find a local site. So what our team does is they give you all the instructions on how to approach the clinical sites, because that process is very lengthy. So as soon as you get a clinical site to say that they have a spot for you, or they have the availability, so we will start the affiliation process with that clinical site, and that process is pretty long. Our team will take care of the communication process, but for the first step, you'll have to work with the team to make this happen. And in case we have any affiliations in the area nearby, our team will recommend you there as well. But even if we are recommending a particular site, or we are referring you to a particular site, we will still recommend you to find sites yourself, so we have more chances of securing one of the sites. And lastly, your question about when is the next enrollment for this program. You can start whenever you want. So talk to the admissions team, schedule the session, and you'll be able to enroll. Do you guys set up with the hospitals, the clinical requirements? I think I just answered this question as well. So we do help with that, but we do not guarantee it, because even if we look at the hospitals where we are affiliated, we cannot guarantee, because sometimes the hospital sites are too far away from where you live, or they're in a completely different state, or they don't have the availability. So we cannot guarantee that, but we can absolutely guarantee all the support that we can offer for you to complete your clinicals at one of the hospitals. And our team will also, one thing that I was going to share for Abigail's question is that our team will share a database of hospitals that you guys can reach out to. And those hospitals are those which are near by your locality. And again, we are not going to be partners with all of them, because if we were the partners, we would have recommended you already. But those are just one starting point for you to reach out and see if they have spots available for clinicals. Have you guys set up the clinical requirements for surgical tech? I think, how do you guys set up the clinical requirements for surgical tech? I think, again, I just answered this question. If you want me to answer it again, I'm more than happy to answer it. And high school is compulsory, yes. So if you don't have the high school diploma or an equivalent qualification, you will not be able to sit for the exam. So if you are scheduled to complete your high school in next 12 months, you can sign up for one of our programs, but you might not be able to sit for the exam unless you complete your high school degree. So we have another question. I've enrolled and paid my tuition for medical assistant program. I've not received any material. Should I contact Carla? Yes, I suggest that you contact Carla because for any students who are coming through Carla, she's the one who will be giving you some of the information about the enrollment. But if you do not get any information from her, feel free to reach out on our support number from the website, and we'll be able to assist you further. But you should be hearing from Carla very soon. So please reach out to her, and she'll be able to get back to you. Any discounts available? We have a lot of discounts that are available. One thing that I forgot to mention, that we do have some discounts that we offer to all of the people who join the webinar. So you will be receiving an email, I believe. My team can confirm that you will receive an email, and discount will be offered to you in addition to the discount in case you are paying upfront, you'll get an upfront discount, and you will also get the discount for being here on the webinar. And if you're going for an installment option, then we will only be giving you the webinar discount. So we have a few discounts options that are available. What is the difference between TSC and CST certification? Tiffany, that's a great question. CST is Certified Surgical Technician or Technologist, and TSC is Tech in Surgery Certification. Now, these are two different certifications for surgical technology that cover pretty much the same content, but the certifying body is different. So the certifying bodies are basically working according to the regulations of each state, and they're trying to make sure that their program is acceptable in most of the states. So CST certification is offered by NBSTSA, and we are not affiliated with them. We are not approved through them, and for that reason, we don't offer that program. We are affiliated with NCCT, and we offer the Tech in Surgery Certification, TSC, by them. And I discussed the syllabus or the format for it very briefly in the session. You can read more about it on the website. Okay, let me see the questions that I've answered, so I'm not repeating them. How soon can the program start, Perry? It really depends on when you complete the enrollment process, pay the upfront or the tuition, whatever you have committed, and it can start in less than 3 to 4 days. It depends. If you want to start sooner, you can request for that, and we can arrange something for you. But it can start very soon because it's on demand. It can start anytime. What sites or areas for clinicals do you have in Michigan? This is a question that I can probably answer, but not during the webinar, because I'll need to open the sheet to see if we have sites available in Michigan. But I would still say the same, that even if we have sites, they might be far away from where you are based, or they might not have a spot. So even if we have it, we will refer you. And at the same time, we will give you all the instructions. Reach out to the sites which are based around your area. There is a video that I recorded recently that you can get from our team, where I explain the whole clinical requirement process. And that's very, very useful for the students to understand how that whole process works. So please reach out to the team, talk to the admissions team, and they'll be able to share information about it with you. So that's done. Can a union pay for your courses monthly? So it depends. I mean, this depends on each case. So you can talk to the admissions team, and they can guide you about it. I personally think it should be possible, but don't quote me for this. I am not 100% sure. So reach out to the admissions team, ask this question to them, and they'll probably be able to help you with it in a much better way. Do we pay for one-on-one for surgical tech? So it is included for 5 one-on-one sessions. One-on-one sessions is the only component that's live. For the rest of the program, it is going to be recorded, or you are going to do it on your pace. So you don't have to pay separately for 5 sessions, but if you want extra sessions, you'll have to pay for that. But the cost of 5 sessions is included in the tuition. So that's done. Answer live is done. Can I transfer credits from a medical technology program? So the thing is that transferring credits is something that we cannot really offer because this is not a degree program. This is a certification program. But if you mean that you have some of the learning from that, and you want us to waive of some of the content that you've already studied, that might be a possibility, but I'm not sure if that's what you're looking for. But if you have completed some program, part of a program, and you want us to waive off some of the courses that we have here because the content is the same, our team will sit and see if that's possible, and if the content is actually the same, and we can waive off those courses for you. So, and we can discuss that in detail. for surgical tech classes starting on 20th, when will we receive our ebooks and start? So you should normally receive the ebooks in, say, 48 hours of starting the course. But it can be different for each of the students in each of the cohort. So please reach out to your advisor and ask this question to them so they can answer it according to your scenario. So because it can be different for each student. But usually we do offer the ebooks in the next 48 hours of starting the program. How soon can we receive our laptops? Thomas, that's again something which is different for each student. So it depends on what has been committed to you. So please reach out to your advisor and they'll be able to help you. Fatima, absolutely. So if you have completed many courses like anatomy and physiology, we will just waive that course off, or we will ask you to, take a crash course and pass the final exam for it, so we can waive it off for you. So we can arrange something for you. Absolutely. Um, and I think we have some of the questions in the chat. Okay, these questions I've seen. Do we pay for one-on-one? Okay. For search check, who is my advisor? Sharmika, that is supposed to be the person who has enrolled you. So if you are already enrolled at HTA, your advisor would be the person who has enrolled you. So whoever is your point of contact, that person is your advisor. Are you affiliated with Sutter? I am not familiar with it. We might be. I'm not familiar with Sutter. My team here can confirm if we are. So they can let me know if we are affiliated with Sutter. Um, I don't think so. How long is the admission process? The admission process, we let me ask that as well. Okay, how long is the admission process? So the admission process is, it depends on you and how soon you can pay, but it depends, and it also depends on, the questions that you want to ask in order to be sure about it. It can take any time between 24 hours to 48 hours or longer, again, depending upon when you pay for it. So as soon as you pay, you are an enrolled student, and from that point onwards, you have to schedule the orientation session with the team. And then they will give you access to the program. Is the surgical tech exam included in the tuition cost? Absolutely. We have the cost of the program is included. So the exam is part of it. You don't need to worry about paying for the exam at the end. So don't worry about that. All right. I think these were most of the questions that we had. And seems like we had quite a diverse audience today with a lot of diverse questions, which is great. And I'm glad that most of you guys engaged. I'm still here. We have another 2 minutes, which means that if you still have some questions, feel free to ask that, and I would love to answer. And if you would ever like to talk to me directly, you can reach out to me at Danish.Khan. You can read my name probably somewhere here or here. Yeah, you guys should be able to see that. And you guys can reach out to me at danish.khan@healthtechacademy.org, and I'll be able to assist you with anything that nobody else is able to help you with. And if you have any questions about the programs, the content, the coaches, anything that you think you need more insights about, I'll be able to help with it as well. Your name is displayed in the same way you've written it, so that's fine. Thank you so much, everyone, for joining in. You guys should be receiving an email very, very soon with the discount, and I am hoping to see all of you guys enroll into our program, and we will see you on the other side. So thank you so much for taking part, taking the time out. And if you guys still have any questions or you joined late, we will have the recording posted on our YouTube. So please make sure that you refer to that if you still have some information that you want to get and you missed a part of the session. And if you have attended the whole session and you still have some questions, reach out to our team and we'll be able to assist you. Take care, everyone. Thank you so much for taking out the time. This is it from my side. Take care, everyone. Bye bye.